In this short video, I'd like to show the practical aspects of recording jitter with the concentric needle electrode. In the recording of frontalis muscle, I sit behind the patient to get a good overview, and we are going to investigate the left frontalis. I ask for a slight voluntary contraction and insert the needle like this. And we obtain a signal like this, and we can trigger on the highest peak here to get the stable, nice signal, and we can move the delay. We can also trigger on the first signal, the smaller one there, but that will also introduce other signals. So in order to get the clean signal, I trigger on the highest. And we see the jitter to the right, and a good trick is to superimpose the recordings during the collection of data. Then we see the jitter much better, but when we are going to look at individual traces, then we separate them in raster mode. I usually use 10 or 15. In this case it is 10. We superimpose 10 and 10, and we have raster 10 and 10. Then we stop here and we read the jitter. That is 14.9 microseconds. We insert the needle at another position in the muscle, ask the patient for a slight voluntary contraction, and here is a triple potential coming. It has relatively high recruitment threshold. There are other motor units that are active in the background. But now we have about 75 discharges, and we can stop and get the jitter there with automatic trigger on the second potential and a jitter of 19.5 and 31.8. And we get another position in the muscle with many components, but three are dominating here, and we get many signals right away. We're triggering on the first one, and we see the jitter on number 2 and number 3, and we can stop here. Here we can, if we wish, change the trigger to the second one or the third one, but this was the best. We move the needle again, and here we get a signal with a very high innervation rate. It's going, and now we have more than 100 discharges, and this is a jitter. There is an inflection point here at a low part of the signal, so this can still be accepted. And if I superimpose, you see as a good trigger, and this part, the main part of the signal, shows parallel lines here. So this is quite okay. I move the needle, and here we get a good recording, and we have now about 100 discharges, and can stop the recording. This big one was a disturbance, but you see the nice recordings are here, and the jitter is 10.7. Then I'm going to show the electrical stimulation. I move the stimulator a little. I ask the patient to help me right for this demo. And here you see that the lower part of the frontalis muscle is moving. Here we have nice contractions right here, and it's too much. And then I decrease the stimulus. We now have a 6 milliamp, and then guided by the position of the testing stimulator, I now fix a permanent stimulator. It can be either a monopolar and a surface electrode, it can be a bar electrode, or like in this case stick-on electrodes. I increase the stimulus until I can see a twitching part of the muscle again, and here we see a twitching part here in the and I insert the needle into the twitching part and start to record. Here are a few spikes. And when I have very little stimulation, they come and go together. So these two come from the same axon. And you can see to the right here that they move together. So it's a jitter from both of them. And here I increase the stimulus just a little, and we get more spikes, and even one more is coming in. Now we have 3 spikes. One is not fulfilling criteria, but we are measuring for the 2 others. And then I increase the stimulus a little and see whether this large one is becoming more constant. Yes, it did. Here it became more constant. And here you see that recording situation. Then I increase the stimulus just a little, and more fibers are coming in. You see the last ones there. I reduce the stimulus just a little, and you see these 2 spikes come and go together. So they are belonging to the same axon. And then I increase the stimulus a little. I can change the sweep speed to show individual spikes. I increase the stimulus just a little, and they become more active, but we did not get more fibers here. Here we get a very large complex of signals, too much of stimulation. I increase the sweep speed a little to see better. This is just a large number of axons. So I change the stimulus strength, and here you see 2 of the components come and go together. Can you see? These 2 big ones come and go together. I decrease the stimulus strength. I decrease it more and more. For measurements, I could say that we want to have just few spikes. I reduce the stimulus. One is showing something that looks blocking, but now we measure between a few different spikes indicated with the markers there. If I increase the stimulus, I'm sure that new spikes are coming in. Yes, and then I reduce the stimulus. Here we can measure jitter, and you see how they all move together a little, because it's a jitter at the stimulation site. I increase the strength a little to make them all more stable, and here they are all very stable. I increase it even more, and now they are stable. And now we are going to do a recording from the frontalis muscle in a patient with myasthenia gravis. Here you see nice single fiber recordings. When we superimpose, they are in parallel rising phase here. So this is a good recording. And the jitter is nicely seen to the right. It amounts to 102 microseconds. At this situation, it is just about to become with blocking, but we don't see any blocking in this particular recording. Here is another recording, in this case with a larger jitter. It's around 200, and it shows frequent blocking. It is easily seen here, but it can also be seen on the superimposition, where you see a line through the recording here. Want to see the frequency of the blocking, we can browse through the whole recording in this way. And this blocking is not due to false trigger, because the first signal here is absolutely constant in shape. So it's the second potential that is really missing. Here's another recording with a large jitter. I trigger on number 2, and we see the jittering signal, but there are no blocks. You see no line through it here, and when we inspect the signals, we don't see any blocking at all. In this case, the jitter is 85 microseconds. Here is a recording with a high firing rate, and the jitter is quite large, and you see the behavior, here. The jitter is about 100 microseconds. Here is multiple recording with complex signals, and we trigger on the second one, and when I stop, it keeps the second. We could have triggered on the first one, but then the summated jitter is much larger, and therefore we go over and trigger on the second one. This jitter is 87 and 19 and 36. So in the same motor unit, you can have different abnormalities among the motor end plates. And now we are recording from the brachioradialis muscle with a slight voluntary contraction, triggering on the second signal. Here's something we call flip-flop, and you see the jitter there. And then I move the needle again. Here's another. The last one is not a pure signal, so we cannot use this. That was a combined summated signal. I move the needle, and we see an early small component. Here's a good recording. And now we have 100. We stop recording, and I try to find a new position. Here's another. The trigger is a little too low, so I lift it up a little. Now we get more stable situation, and you see the jitter in. Now I moved the electrode a little, so the second one is the biggest, and here we get a good recording, and then we can superimpose 15, and you see the jitter display there. Okay, it's a complex signal, and here we have a few components that look very nice, and that is enough. We got 100 there. So I think that is enough for this muscle, that it is a little more complex than the frontalis, and it's definitely not as complex as EDC, or even worse, the tibialis anterior muscle. This is the recording from the extensor digitorum, and I insert needle, and you see we find a signal there. The first one is a little irregular, and I move the needle to get a good first component. Stop. And then I move to another position. And here we have one early component that is very low in amplitude. And I move the needle and we can get it up, and we are now recording from a good signal. Stop. We move to another position. The second component is not interfering with the first peak, so this can be used for measurements. And also we have a late component that is not the violet one that we do not accept. This is a recording from the tibialis anterior muscle in a patient with a history of L5 radiculopathy some years ago. It will probably show neurogenic changes, and this is a demo then of the neurogenic jitter that we will see. Here the last component is jittering. And we can see the superimposition at the bottom of all 100. And here is the superimposition of only 15 at a time, and we can move that through the collected area of signals. This signal, the beginning there, it's not possible to measure. They're very close together. You see the increased jitter, but I don't use it. There's one late component coming in. I move the change the delay a little, and you see the late component there is blocking. This was the end of the practical demonstration of the use of concentric needle electrode for jitter measurements. It's important that we collect high quality data for analysis and do not rely on post-processing editing. Regarding post-processing, it's not feasible to make post-processing for the stimulated SFEMG. All the quality control must be made during ongoing stimulation with changing stimulus strength and so on. For voluntary SFEMG, then the post-processing is mainly aiming at looking at signal quality by browsing
through the whole recording. Sometimes special tricks must be made, and I will show you a few examples of that.
With voluntary activation, there are a few occasions where it's obvious to get rid of some of the signals, and I'm going to show you a few of those examples. Here's a recording, and we trigger, and the signal is coming down here. And as you see, there was an electrode movement seen at the bottom of the dot plot here, and this area is obviously erroneous and should be removed. The jitter now, with all dots included, is 27.4, but if we restrict the acceptance area going here, then we see that the jitter is somewhat lower, and in the signal we see this phenomenon you see in the middle part here, and then I go down and you see the transition to the other here, right in this area. So this is removed, and we report this jitter value. And here is an editing feature that is probably the most common, namely when we have the signals like this and we have this situation and we want to remove one trace, the whole trace. Here all traces are nice, but for the demonstration I press the trace, it becomes blue, which means not included. And I can also remove just one dot. I go to that dot and right click and get it blue. The other dots are still active. Normally the SFEMG recording should be made with very slight contraction. Here we have one with a quite strong contraction, and therefore other motor units are disturbing. Here we see such a situation where we have activity from adjacent motor units. These are not included in the analysis. As you can see, there are no indicators, no dots at the top of these signals, so they are not included. And we can also, if we wish, just for the clarity to get the signals nice, we can cut these signals like I did here. The jitter value does not change. Here is 29.2, and here is about the same. It was 29.7 here. So and I can do that same thing here. We have a jitter of 30.2, and if I remove these signals is 30.1. Now it became a little smaller. This type of editing is not necessary, since the signals are not included, and it is not worthwhile spending time on such things. Here is a situation where the visual detection can be very important. You hear a complex signal here, and in the overview you can see a fourth component, and then we need to change the sweep speed in order to allow that to be seen in the screen, and we can move this over here. This has a delay of 15 or more milliseconds, and that is usually not used for jitter analysis. If the latency is more than 4 milliseconds, the value are not very reproducible. In this case, it's very low jitter values, and this happens to be within normal limits, so that can be accepted. All these three values can be accepted here. Here is a situation where the visual analysis after the recording is necessary. Here you can see this is a patient with myasthenia, and you see that the second component is missing now and then, and that is a real neuromuscular blocking. If the trigger level had been little lower, I can reduce this to a lower part here. Then we all of a sudden start to trigger on other signals. For example, here, this small signal here is the triggering, and this looks like a block, but that's not true, since we did not have any reference potential, and it seems as blocking through here, and you can from this picture differentiate the real and the technical block, but here it is very easy to detect. Now we are going to look at the recording from tibial anterior in a slightly neurogenic muscle. Here is a recording, and we have multiple spikes, and we trigger on the first low one, and you see that the dots are aligned here. When I stop the recording for analysis, then it happens to be that the third spike is triggering, and that is based on the fact that with triggering on different spikes, the jitter value for the others will be higher or lower, because the triggering spike has also a jitter. If we, for example, see that the jitter is 60, 84, 18 and 34, if I trigger here, then we get 91, 84, 87, 70, very high values. So this has the lowest jitter sum, J sum, and this is automatically indicated here. This was only a demonstration of that particular feature, has nothing really to do with editing.
So once again, do not rely on getting a good quality by post-processing. Normally the quality is defined already during the recording itself, so that post-processing editing should be kept to a minimal level. Thank you very much for watching.